On January 1st, 2014, Brittany Maynard was diagnosed with stage 2 astrocytoma, a type of brain cancer. 9 days later, she had a partial craniotomy and a partial resection of her temporal lobe in an attempt to remove the tumor. In April, she was told the cancer had returned at a more aggressive pace, stage 4. She was given 6 months to live. After weeks of research, Maynard came to the conclusion that no treatment could save her life. Radiation would singe the hair off her scalp and leave her with first-degree burns. Even with palliative medication and hospice care, she could develop morphine-resistant pain and suffer personality changes and verbal, cognitive, and motor loss. With a young, healthy body, Maynard could have suffered for months. Instead, she decided that death with dignity was the best option for her and her family. On November 1st, 2014, with her husband, mother, father, stepfather, and best friend by her side, Maynard took the fatal drugs prescribed by her doctors and passed away on her own terms. Physicians are required to help their patients, but when people are diagnosed with terminal illnesses, medical treatments can do little to stop the progression of the illness. Terminal illnesses are usually followed by immense pain and suffering, depression, and loss of awareness as the illness progresses. Families are subjected to watching their mothers, fathers, brothers, sisters, and children go through this terrible ordeal without being able to do anything to stop it. Rather than allow this to go on, physician-assisted suicide is a way for patients to end their own and their family's sufferings by allowing them to choose when they want to die. Physician-assisted suicide should be legalized in order to be considered a viable option when a patient is diagnosed with a terminal illness. Whereas euthanasia is an act committed by a physician and can be seen as murder, physician-assisted suicide is completely dependent on the patient. In an article published in the Journal of the Moffitt Cancer Center by Dr. Robert Walker, MD, euthanasia is defined as an act whereby a physician intentionally causes the death of a terminally ill patient. This means that if a physician injects a lethal amount of a substance into a patient for the express purpose of terminating the patient's life, the physician is performing euthanasia. Whether voluntary or not, euthanasia is considered a form of homicide and is illegal in the United States. In comparison, physician-assisted suicide allows the patient and the physician to work together to bring about death, with the patient taking the final action to end life. Since the patient is the one taking the final action, the physician has little to no role in the patient's death. This allows physicians to assist their patients without being held responsible for their deaths. Due to numerous restrictions on who may participate, physician-assisted suicide is very unlikely to be misused. In Death with Dignity Acts already established, in order to participate, a patient must be 18 years of age or older, a resident of that state, capable of making and communicating healthcare decisions for themselves, and diagnosed with a terminal illness that will lead to death within 6 months. Because of these restrictions, children, mentally impaired people, and people without terminal illnesses are all exempt from physician-assisted suicide. Though some believe that people with incurable but not necessarily terminal conditions who feel that their suffering is unbearable could be able to participate in physician-assisted suicide in order to end their suffering, the restrictions exempt such patients to make sure that only people who truly have no other option can partake in the action. For example, several elderly people develop illnesses as a side effect of growing old. While this is sad, these types of people should not be able to choose physician-assisted suicide as an option because they could still have several years to live. Only those people who have a limited amount of days left should be able to choose if they want to die early or let their terminal illnesses kill them. If the patient meets the criteria, there are several steps that need to be taken before medication is prescribed. First, the patient must make 2 oral requests to the attending physician, separated by at least 15 days. Second, the patient must provide a written request to the attending physician signed in the presence of 2 witnesses, at least one of whom is not related to the patient. Third, the attending physician and a consulting physician must confirm the patient's diagnosis and prognosis and determine whether the patient is capable of making and communicating healthcare decisions for him or herself. If either physician believes the patient's judgment is impaired, the patient must be referred for a psychological examination. Next, the attending physician must request the patient to notify their next of kin of the prescription request, and lastly, the attending physician must inform the patient of feasible alternatives to physician-assisted suicide. Throughout this process, there are several safeguards set up to ensure that only the most qualified patients are allowed to utilize physician-assisted suicide. Physicians generally wish to help rather than hurt their patients, but in the extreme case of terminal illness, death is considered a better option by some patients. According to existing physician-assisted suicide laws, only a doctor of medicine or osteopathy licensed to practice medicine is qualified to assist in physician-assisted suicide and is not required to participate. By having a licensed physician prescribing medication meant to end life, patients who wish to end their suffering can do so without the side effects and consequences of attempting to commit suicide in other ways. The most common medications prescribed for physician-assisted suicide are secobarbital and pentobarbital, drugs used to treat insomnia, taken at bedtime in order to ensure a peaceful passing. In order to further the safety of physician-assisted suicide, patients are able to rescind their request at any time after the initial request. During the process to maintain a prescription for lethal medication, the patient's physician is required to offer the patient an opportunity to rescind his or her request at the end of the 15-day waiting period following the initial request. This offer allows the patient to rethink and reverse their initial decision if they desire to. The physician must also inform the patient of feasible alternatives to physician-assisted suicide, such as comfort care, hospice care, and pain control. Once given the prescription, patients are not required to ingest the lethal medication. Unlike euthanasia, patients can still decide not to go through with physician-assisted suicide, even after the process to obtain the medication. In cases like Brittany Maynard's, physician-assisted suicide is simply an empathetic option for terminally ill patients who are bound to die anyway. It gives patients the right to make their own choices concerning their deaths and allows them to maintain their dignity as they near the end of their lives. Physician-assisted suicide is not for everyone, but it should be permitted for the people who wish to die on their own terms.